In the event of new virus COVID-19 pandemic, UK government published Coronavirus Action Plan. If you haven't read it, you must do it. It describes in black and white what changes to expect here in UK. It's literally in plain sight. So what do we know about COVID-19? On page 5. It's a new virus and our population doesn't have any immunity and we do not have effective vaccine just yet. It's also described as self-limiting illness, similar to seasonal flu. Severe disease and death increase amongst elderly people and people with underlying health conditions. Children or pregnant women are not seriously affected. In China, we know that the numbers of infected are decreasing and recoveries are increasing. I believe they really tackled this disease very, very well, and we can learn from them. 30 Chinese medical experts got together and came up with a comprehensive COVID-19 virus treatment plan. According to them, the highest risk group are elderly people and people with underlying health conditions. Most patients have a good prognosis and children and infants will develop disease, but the condition is going to be mild. Back in UK, 35 people who passed away from coronavirus, they all were elderly people with underlying health conditions. This is our risk group. I believe that everything has to be about how to help this group. So why COVID-19 is getting so much media and government's attention this year? Now on page 9, on proposed plans, we can see the agencies responsible for tackling the outbreak are properly resourced to do so, and that any necessary changes to legislation are taken forward as quickly as possible. So how does that translate in real life? MP Rishi Sunak pledged £30 billion to offset the impact of coronavirus, and literally a blank check to NHS. I'm just a bit concerned what is going to happen when we will have to pay off that debt. Now back to changes to legislations on page 12. We can see new regulations introduced in England under public health legislation provide new powers for medical professionals, public health professionals and the police to allow them to detain and direct individuals and do with them whatever they want. Now let's look on legislation.gov.uk. It is actually even more powers to detain on or even fine members of public. And let's look to another page. Right to use reasonable force if necessary. Similar legislations are passed in Denmark, where authorities can forcibly detain, treat and vaccinate. And here's a simple example of new changes to legislations being enforced here in UK. Newborn baby and mother test positive for coronavirus. Medical authorities decide that the best way is to separate mother and baby, even though on page 5 of Action Plan and Chinese experts state that infants and pregnant women will be mildly affected by this illness. Separation from mother at birth can cause trauma for the rest of the child's and mother's lives. So let's get back to Action Plan. On page 10 we have 4 phases of this plan. First one is contain, second one delay, third research and fourth mitigate. Pay attention to research because that's where we are at the moment. It's to better understand the virus and find the best treatment for UK population. So far, UK government is completely ignoring Chinese example. They have high success with treating ordinary patients or light cases, mild cases with high dosage of vitamin C and T. That is not good enough for UK. Vaccines are the only answer. The page 15 of the action plan, we can see that the government already allocated £20 million for COVID-19 vaccines and also £20 million for COVID-19 research to understand it, and also to support proposals for projects to develop vaccines. The real number is really about 65 million. So as a public, we can't make any decisions about treatments. So what could we do to help the situation? The answers are on page 16. Reducing the impact and spread of misinformation by relying on information from trusted sources. So please do not watch this video. Also, ensuring you and your family's vaccinations are up to date. Again, vaccinations. More suppression, more propaganda. And if that is not enough, if the situation gets worse and our chief medical officers will decide which phase we are in, but if it is getting really bad, the Ministry of Defence has put in place plans to ensure the delivery of its key operations in the UK and overseas. There are also well-practiced arrangements for defence to provide support to civil authorities if requested. That sounds like martial law. So to summarize what I learned from Coronavirus Action Plan is: number 1, NHS and other medical organizations will receive unlimited funds to provide necessary care and treatments during outbreak. Number 2, new legislations will give powers to authorities to carry out UK's government's orders. Number 3, a lot of money goes into COVID-19 research and into vaccines development. Number 4, as UK's economy will be negatively affected, we might need Ministry of Defence to enforce martial law on UK soil. And it's all for the benefit of UK's public to fight a deadly virus.
The best lessons, I think, on how to get prepared are, again, what we do for war. What are the key pieces? First is we need strong health systems in poor countries. That's where mothers can give birth safely, kids can get all their vaccines, but also where we'll see the outbreak very early on. We need a medical reserve corps. Lots of people who've got the training and background who are ready to go with the expertise. And then we need to pair those medical people with the military, taking advantage of the military's ability to move fast, do logistics, and secure areas. We need to do simulations, germ games, not war games, so that we see where the holes are. Finally, we need lots of advanced R&D in areas of vaccines and diagnostics. Now, I don't have an exact budget for what this would cost, but I'm quite sure it's very modest compared to the potential harm. The World Bank estimates that if we have a worldwide flu epidemic, global wealth will go down by over $3 trillion. And we'd have millions and millions.
So what does Bill Gates have to do with coronavirus in UK? As I mentioned before, and if you look on the page 24, our government's actions depend on the advice from two important people: Government Chief Scientific Advisor and Chief Medical Officer for England. Let's see who they are. Dr. Patrick Vallance is Government Chief Scientific Advisor. Before, he was in leadership of GlaxoSmithKline. If that's not enough for you, I'm going to cover a few aspects of what GlaxoSmithKline is doing at the moment. Now, Chris Whitty is Chief Medical Officer for England. Please note that Mr. Whitty worked in London School of Hygiene and Tropical Medicine. And an interesting fact, in 2008, the Bill and Melinda Gates Foundation awarded the London School of Hygiene and Tropical Medicine a whopping £31 million for malaria research in Africa. In 2011, and the School of Hygiene and Tropical Medicine published RTS S/AS01 vaccine for malaria trials results in Africa. Parents didn't know that it was a trial. I can't show that article here because it's for personal use only. So I'm taking extracts from some comments about these trials. Last year, a follow-up study found that when given in 3 doses, the vaccine had negative efficacy 5 years after the first shot was delivered for kids who live in places with higher than average potential exposure to parasite-bearing mosquitoes. That means that kids who received 3 doses of the vaccine actually contracted malaria more than kids who didn't. And in 2015, the World Health Organization's expert panel on immunization refused to recommend a use of the vaccine. NHS published trial results in 2011. What do we find? There were a similar number of side effects in children who received the malaria vaccine as in children who received the control vaccine, but there were more cases of meningitis and seizure in the group that received the malaria vaccine. What? And then let's see, it was funded by GlaxoSmithKline and the PATH Malaria Vaccine Initiative, which received a grant from the Bill and Melinda Gates Foundation. Despite awful results in 2011, malaria vaccine is rolled out in 3 high malaria countries in Africa in 2019. World Health Organization knew that this vaccine is ineffective. Dr. Valens was head of medicines discovery and development between 2010 and 12, and then in 2012 he is becoming a leader of GSK. He is working in antibiotics and medicines for tropical diseases. That's interesting. At the same time, Dr. Whitty worked in London School of Hygiene and Tropical Medicine. So definitely their paths had to cross. Now you remember these numbers for vaccine development. Guess what? GlaxoSmithKline starts working with Moderna, one of the companies which is probably the closest in discovering vaccine against coronavirus. However, their methods are questionable. It seems that they decided to skip a animal testing stage in this vaccine. However, GlaxoSmithKline are not picky. They will work with anyone who is going to take them to that beautiful cash spot. So here you go. There is another company they are working with, is Clover from China. And GSK are offering pandemic adjuvant system, not just to Clover, but other companies they are working with. What is that pandemic adjuvant system? Let's look up. It has been used in swine flu vaccine Pandemrix. A part of nasty ingredients, Pandemrix also associated with narcolepsy. In 2009, swine flu was announced as a pandemic worldwide. Now, 6 million people in Britain and more across Europe were given the Pandemrix vaccine made by GlaxoSmithKline during that outbreak. But the jab was withdrawn after doctors noticed a sharp rise in narcolepsy among those who received it. It seems to me that our 2 medical experts advising our government on coronavirus outbreak have very shady paths. I wouldn't trust their advice, and I think there is a conflict of interest. Do they represent the best UK public's interest or their own interests?